medial trunk. Medial trunk number 7. Number 7, and I explain you on the border this medial. Paired processus spinosus and paired processus transversus. If we say about muscles of medial tract, this muscle, we have 3 types of muscles. They have similar direction but have a different. I explain you. These muscles begin at the transverse process of underlying vertebra and attach to the spinous process of overlying vertebra. So it's have oblique direction. So these all muscles of medial tract have similar direction. Begin in one place on the transverse process and attach to the spinous process. 3 types of muscles: musculus semispinalis, musculus multifidi, and rotatoris. The most short is musculus rotatoris because they going up over 1 or 2 vertebra. Then going musculus multifidi. They going from 2, 3 vertebra. And musculus semispinalis is the most long because they going over 5 or 6 vertebra. So this is musculus semispinalis, this is multifidi, this is rotatoris. Now you understand they are going all trunk: cervical, thoracic, lumbar vertebra. So the medial trunk have 3 different muscles. They have similar direction. Begin at the transverse process and attach to the spinous process, but different how they are long. Remember, multifidi is very short, over 1 or 2 vertebra, different. Then going multifidi, they going 2 or 3. And then semi-spinalis, they going from 5 and 4. Understand? You can see they have similar direction, but some of them more short, then middle, more long, and then the most long. It's about a medial tract. And if we say about deep muscles, we can see accipita vertebral group. This is accipita vertebral group. This is deep muscles too, but they are separated because located on the head. Accipita on the occipital region. Accipita vertebral group. You can see number 2, 3, 4, and 5 in common. 4 muscles, 2 of them is oblique direction half, 2 of them is a stretch direction half. Oblique number 5 and number 4. Musculus obliquus capitis inferior number 5. Musculus obliquus capitis superior number 4. Musculus obliquus capitis inferior begin at the level of second cervical vertebra and attach to linea nucha superior of occipital bone. And musculus obliquus capitis superior begin at the level of first cervical vertebra atlas and attach to the linea nucha superior of occipital bone. And 2 rectus muscle, 2, 3. Number 2, musculus rectus capitis minor, and number 3, musculus rectus capitis major. They begin at the one level, but major it's more big. It's begin at the second cervical vertebra. First at the level of first cervical vertebra. Number 2, 3, 5, 4. Number 2, musculus rectus capitis minor. 3, musculus rectus capitis major. 4, oblique muscle. Musculus obliquus capitis superior, and 5, inferior. And 2 last muscle located on this region too, but most superficial. Number 1 and number 2, musculus splenius capitis. So this is cervicis and musculus splenius capitis. Cervicis begin at the level of lower cervical and attach to upper cervical vertebra. and capitis begin at the level of cervical vertebra and attach to the occipital bone and mastoid process of temporal bone. And about muscles of back, this is all. So firstly, classification superficial, deep, superficial two group. Some muscles attached to ribs, some to the shoulder. Yes, to the shoulder trapezius, latissimus dorsi, rhomboideus, and levator scapula. To the ribs, serratus posterior superior, serratus posterior inferior. It's superficial muscles. And deep, divided to tract. This is like the road. We have medial tract, very near to columna vertebralis, and lateral tract. Lateral tract, this is musculus erector spina. This made by three muscles, 12, 30, 40. 12 musculus spinalis, 40 musculus longissimus, and 40 musculus iliocostalis. And medial tract, it's making by muscles multifidi, rotatoris, and semispinalis. They begin and ending similar, going from lower to upper, but have, different sizes. Some of them it's more long, some of them it's more short. And we have muscles of occipita vertebral group. Two muscle oblique, musculus obliquus capitis superior 4, musculus obliquus capitis inferior 5. And two rectus muscle, musculus rectus capitis major, 2 is minor, 3 is major. Minor more medial than major located. And about muscles, I think this is all. Understand? Difficult? No, more difficult maybe it's teach the beginning and ending.
Okay.
No, sometimes it's slow. No, you can see how they begin. It's not teach number of vertebrae. Say cervical or thoracic or lumbar. You cannot teach, for example, lower because in some muscles writing, for example, cervical vertebra 5 to 7, you can only cervical or lower cervical, for example, say. I understand this. So, and you can correct, show this. If I see that you don't understand the well-located muscles, unfortunately, it's only 3. Only 3 mark. So, who wants 5 or 4 can show on the pictures.